Well, anyway, Channel 3, your back to school authority, and as the first day of the year for families gets closer and closer, we're starting with an entire month of coverage of stories that matter for you.
Yeah, in our state, parents have followed the same childhood vaccine schedule for years.
So a new CDC panel expected to meet to consider whether to revise, roll back, or hold steady on current vaccine guidelines. Your health reporter Tracey McCain explains how this meeting could change things for your family.
Right now, nothing changes. Connecticut's childhood immunization schedule remains the same, but flu and COVID vaccine recommendations have shifted, which is raising some concerns after both viruses surged earlier and lasted longer last season.
I can't say it enough. Washing your hands.
The best prevention starts before you ever go to the sink.
Whoa, fantastic.
And for doctors, that means the basics. Staying up to date on childhood vaccines for measles, mumps, rubella, polio, chickenpox, hepatitis B, and DTaP. That's diphtheria, tetanus, and whooping cough.
The American Academy of Pediatrics and virtually all pediatricians are very comfortable with the current vaccine schedule because we found that, again, it's been very safe and effective at preventing some of these serious diseases.
Dr. Thomas Murray is a pediatric infectious disease specialist at the Yale School of Medicine. He says along with the routine childhood schedule, parents now also need to consider this fall's updated flu and COVID vaccine recommendations.
Vaccines have a long history of being a safe way to prevent infection, and as we've seen with the measles outbreak, when children are not vaccinated or our population is under-vaccinated, you can have high rates of hospitalization and even death.
In July, the CDC ended its recommendation for COVID vaccines for all adults and for children ages 6 months to 17.
Have recommended that the COVID vaccine not be given to pregnant women, but that has not been a universal recommendation. There's been a recommendation not to use influenza vaccines that contain thimerosal.
Dr. Murray says vaccines save lives and can even keep sick kids out of the hospital. For perspective, take last year's respiratory illness season. The state health department tracks it all on their website. You can see cases started climbing just before Christmas, peaking around Valentine's Day with a surge in flu cases, RSV, and COVID. It wasn't until just before the 4th of July that things finally returned to more typical levels, but hospitalizations remain low among a mostly vaccinated state. So while there's no way to know what's to come from the CDC's next meeting,
So I think we have to wait and see what those suggestions are.
Dr. Murray says staying informed will be just as important as staying on schedule.
Okay, so no need for parents to be concerned right now.
Not to my knowledge.
Updated flu and COVID shots for the season will be available, but because the recommendations on who should get them have changed, you will want to check with your doctor first. And as for the routine childhood vaccines, make sure your child is up to date. In Connecticut, those shots are required for school. Your health reporter in studio, Tracey McCain, Channel 3 Eyewitness News.
All right, thanks, Tracy. And today on Channel 3 Eyewitness News, you get to tune in for Stephanie Simone's tips on how to make sure everyone in the house is getting enough sleep by the time the first day of school rolls around. Hi, how ironic I read that line.
How do you get sleep, period?
Yeah.
I would love to know. Hey, if you missed one of these stories or if you want to see something again, you can watch all of our back to school specials on demand on WFSB Plus and the streaming app.
All right. And Marcy, we're going to send it on over to you.